The Institute for Health Metrics and Evaluation predicting 2 out of 3 states in the DMV appear to be making progress in the battle to contain coronavirus. Data released by IMHE Monday projecting peak coronavirus cases in Washington, D.C. have come and gone, revising earlier estimates that D.C.'s peak would happen around April 15th. IMHE now saying its model shows peak hit in the district on April 3rd. The research also suggesting the total number of people who die from coronavirus in D.C., once projected to be around 218, now could number about 58.
We are acutely aware of the importance for us to get this right, because we don't want to mislead decision makers.
On Friday, Mayor Bowser said she believed IMHE's numbers were too rosy. The mayor's spokesman told me Monday her position hasn't changed. But on a conference call with reporters, IMHE's director said his team is confident in its projections that show the strict social distancing guidelines now in place across most of the country does help stop the spread of the disease. IMHE has revised peak impact in Virginia from May 20th to April 20th and dropped its projected death toll there from more than 3,100 to around 1,000. In Maryland, the news wasn't as good. Although IMHE did move up its projected peak there from April 28th to April 19th, researchers also upped the total number of deaths expected in Maryland from 1,700 to more than 2,300. Dr. Murray didn't address that projected uptick specifically, but he continued to hammer the point that all these estimates go out the window if leaders relax social distancing guidelines.
The potential for rebound is enormous if we let up on social distancing.
And Governor Hogan's office tells us the Maryland Department of Health is looking at several available models to help get a better understanding of how things could play out. So to be clear, this is just for planning purposes. State leaders are not relying on one single model.